Hi, this is Susan Berghoefer, and today I'm going to be demonstrating the axial muscles of the cat. Here we have the digastrics. They originate on the inner surface of the mandibular symphysis and mastoid process. The insertion at the hyoid bone. Action is to depress the mandible and elevate the hyoid and larynx when swallowing. The mylohyoid is here. It originates on the inner surface of the mandible. Insertion is at the body of the hyoid bone, and the action is to depress the tongue when swallowing. The sternohyoid is here, and it originates at the sternal end of the clavicle and posterior side of the manubrium. Insertion at the body of the hyoid bone, and the action is to depress the hyoid and larynx. The sternomastoid is here, this one here, right there, and it originates at the manubrium and the medial portion of the clavicle. Insertion is at the mastoid process of the temporal bone, and the action is to bilaterally flex the neck. The clavotrapezius is here in the back, and this is the clavotrapezius muscle here. It originates at the superior nuchal line of the skull and the medial dorsal line of the neck. The insertion is at the clavicle, and the action is to draw the clavicle dorsally and cranially. Going back to the front of the cat, we have the masseter muscle, and the masseter is here, and this is the muscle of mastication or chewing. It originates on the zygomatic arch. Insertion at the angle and ramus of the coronoid process of the mandible, and the action is to chew and close the lower jaw. Moving to the abdomen, we have the linea alba, which is this white line right here, and it's a tendinous sheath that serves as a fusion point for many of the abdominal muscles, and it's just the line here. The rectus abdominis is this white square here, if you can make that out. It's the square area, and it originates on the pubic crest and symphysis. Insertion at the xiphoid process and costal cartilages of ribs 5 through 7, and it allows for lumbar rotation. The external obliques are here, and they originate at the outer surface of the lower 8 ribs. Insertions at the linea alba, so they insert right here to this linea alba, the pubic crest and tubercle, and also at the iliac crest. The action is flexion of the vertebral column, compression of the abdominal wall, and it aids the back muscles with lateral rotation and flexion. The internal obliques are here, and they originate on the lumbar fascia of the back, the iliac crest, and inguinal ligament. The insertion is at the linea alba again here, and the pubic crest, and the costal margin of the last 3 to 4 ribs. The action is flexion of the vertebral column, compression of the abdominal wall, and it also aids the back with flexion and rotation. The transversus abdominis is this purpley muscle here, this one, and it originates on the inguinal ligament, lumbar fascia, and the cartilages of the last 6 ribs, also at the iliac crest. Insertion is at the linea alba and the pubic crest. The action is to compress the abdominal contents. The pectoralis muscles up here, we have the pecto antebrachialis, this one here, and it originates on the manubrium. Insertion is at the fascia of the forearm, and the action is to draw the arm to the chest. The pectoralis major is here, and it originates at the sternal end of the clavicle, the sternum, ribs 1 through 7, the aponesis of the external oblique muscles. Insertion is at the intertubercular sulcus of the greater tubercle of the humerus, and the action is that it's a prime mover. It allows for arm flexion, adduction, and it pulls the rib cage up. The pectoralis minor here, it's actually larger in cats. It looks bigger than humans. It originates at the anterior surface of ribs 2 to 4 or 3 to 5 depending on the size of the cat. The insertion is at the coracoid process of the scapula. The action is to draw the scapula down and forward and bring the rib cage up. Xiphi humoralis is here, and it originates at the xiphoid process. Insertion at the proximal end of the humerus, and it adducts the forearm. We're going to look at some deep muscles now. The subscapularis is here inside. It originates on the subscapular fossa of the scapula, inserts on the lesser tubercle of the humerus, and the action is to stabilize the shoulder joint, holds the head of the humerus in the cavity, and it rotates the humerus. The teres major is here. This teres major originates on the posterior surface of the scapula at the inferior angle. Insertion is at the lesser tubercle of the humerus, and the action is to extend, adduct, and medially rotate the humerus. The scalenes are here. The anterior one is deep up inside. Here's the anterior scalene. It originates on the posterior tubercle of the transverse processes of vertebrae C3 through C6. The insertion's at the scalene tubercle of the first rib, and the action is to elevate the first rib, flex and rotate the neck contralaterally, side to side. The scalenus medius is here, and it originates at the posterior tuberosity of the transverse process of the 2nd to 7th cervical vertebrae. Insertion at the superior surface of the first rib behind the subclavian groove. Action is to flex and rotate cervical vertebrae, raise the first rib, and flex the neck. The scalenus posterioris is here, and it originates on the posterior tuberosity of the transverse process of the 5th through 7th cervical vertebrae. Insertion is at the exterior surface of the second rib, and the action is to raise the second rib and flex and rotate the neck. The serratus ventralis is here. It's this big muscle here. It originates on the first 10 ribs, or ribs 1 through 10. Insertion at the medial surface of the scapula, and the action is to draw the scapula to the thorax. Other muscles that move the upper limb. The dorsal view, we're going to look at the latissimus dorsi, which is here, and it originates on the spines of the lower 6 thoracic vertebrae, lumbar vertebrae. iliac crest via the fascia, the sacrum, lower 3 to 4 ribs, and the inferior angle of the scapula. The insertion is at the floor of the bicipital groove of the humerus, and the action is that it's a prime mover, and it adducts, medially rotates, and extends the arm at the shoulder. Now we're going to look at some shoulder muscles in the trapezius, and the clavotrapezius is again here. The same one we demonstrated earlier, and it originates at the superior nuchal line of the skull and medial dorsal line of the neck. Insertions at the clavicle, and the action is to draw the clavicle dorsally and cranially. The acromiotrapezius is here, and it originates at the spines of the cervical vertebrae. Insertion is at the spine of the scapula, and the action is to draw the scapula dorsally back. Okay, spinotrapezius is here, and it originates at the spines of the thoracic vertebrae. Insertion is at the fascia of the scapula muscle, and the action is to draw the scapula dorsally. The levator scapulae is here, and it originates on the transverse processes of vertebrae C1 through C4. Insertion is at the medial border of the scapula and superior to the spine. The action is adduction, elevation of the scapula, and it moves the glenoid cavity down and flexes the neck. Deep muscles of the back and shoulder. The supraspinatus is up here, and it originates at the supraspinatus fossa of the scapula. Insertions at the greater tubercle of the humerus. The action is to help the deltoid abduct the arm at the shoulder. It stabilizes the shoulder joint by drawing the humerus to the glenoid cavity, thus it prevents dislocation. The infraspinatus is down here, and it originates at the infraspinous fossa of the scapula. Insertions at the middle portion of the greater tubercle of the humerus, and the action is to laterally rotate the arm at the shoulder, and it also stabilizes the shoulder joint by drawing the humerus into the glenoid cavity so the humerus does not get dislocated. The rhomboideus is this muscle here. It's this whole thing. This part's just not cut open, and it originates on the spines of the thoracic vertebrae. Insertions at the ventral border of the scapula, and it draws the scapula dorsally. Next we have the rhomboideus capitis, which is this one. It originates at the superior nuchal line, inserts at the angle of the scapula, and the action is to draw the scapula cranially up. And that's it, the end.